Welcome, my dear students, to Chips and Game for Rats. In this class, I shall be dealing with a topic of cirrhosis. And on the screen, we are seeing a plethora of pictures. I have taken the pain to compartmentalize the entire presentation into 4 squares or rectangles, which we shall be unleashing one by one. Let us go to the theme proper. First things first, the normal. After all, pathology is abnormal. On the screen, we are seeing the external and the cut surface of the normal liver. The normal liver is slightly brownish, or we can call it brownish red, and it is capsulated. We are finding the 2 main lobes over here, the right and the left lobe. And this is the capsule that is covering over it, and the cut surface is more or less homogeneous, but if you look carefully, there will be fine, delicate, dark and light areas. This will be the gross picture. Coming to the microscopy, always I used to appreciate one thing called as architecture. So this is the architecture. What do I mean by the word architecture? It's a superb building. Fine. I think this design must be having a copyright. Architecture, as far as pathology is concerned, is the relationship of one part of the tissue to another. Here, for example, we are seeing the central vein, we are seeing the portal triad, and the dark pink lines are the radiating cords of hepatocytes. The paler area will be the sinusoidal spaces. Central vein, portal triad, cords of hepatocytes, sinusoidal spaces. The same thing is diagrammatically depicted over here, which I would like you people to kindly see. This particular picture is called a reticulin stain. This is used to stain the fibrocollagenous tissue to study the framework only. The parenchyma is not seen in this. You are seeing only the frame. Now this is the normal liver. One of the first changes will be the fatty liver. So this is a specimen of the liver. Normally the liver weighs about 1.5 kg, whereas here it can be massively enlarged up to 4.5 kg. Externally, compared to this, there is a clear yellowish edge, and the capsule is stretched and shiny. It is intact, smooth, glistening, but no nodularity. When I go to the cut surface, it is again homogeneous, but compared to this, it is more yellowish or yellowish brown, greasy. It will be as though the knife is passing through butter. That will be the gross picture. 4.5 kg, yellowish in color, stretched and shiny capsule, cut surface, homogeneous, yellowish or yellowish brown. And when I go to the microscopy over here, compare this with this. Here, the cords of hepatocytes are all almost solid, whereas in this one, I am finding multiple bubbles in the picture. These are nothing but the enlarged hepatocytes which have got vacuoles of fat. The empty spaces are fat because the fat is dissolved when it is processed by means of alcohol, which is used for tissue processing. And look at this one again, a central vein and this. It is a little bit effaced. I'm not able to make out the structures very clearly. Ballooned out hepatocytes and then empty vacuolation. This can also be seen in some conditions called as hypoxia. I'm able to see a central vein, the cardiac strands over here. The peripheral part of the lobule is showing a fatty change. There are a lot of causes, but in this one, I will be restricting myself to alcoholic hepatitis. So this is fatty change, the first rectangle. The next one is alcoholic hepatitis. The suffix itis means there is inflammation. The same fatty change as we had seen in the earlier picture continues. So this is seen over here, but this is a Porter triad, and this is again probably a Porter triad, but I'm finding multiple dark blue dots, which mean inflammatory cells. So there is a periportal inflammation. We call it as Porter triaditis. So in the early case, there is Porter triaditis, and there is also the same fatty change that is continuing. Sometimes the cells can get ruptured to form fatty cysts. This picture again, there is an inflammation, but added to that, I am finding some tails of it going into the hepatic parenchyma. So this is a parenchyma, this is again a parenchyma, multiple vacuoles are seen, but concentrate on this tail. This is the spurs of fibrous tissue, which is indicative of early cirrhosis. In cirrhosis again, we will be seeing some kind of inclusions. These are all hepatocytes. If you look at it carefully, within the cytoplasm of the hepatocytes, there is some eosinophilic irregular material that is precipitated or deposited. These are called the Mallory's hyaline, formed out of intermediate filaments, which is suggestive of alcoholic liver disease, but it can be seen in a number of other conditions, such as hepatocellular carcinoma or Wilson's disease, and so on. So these are the three changes we should be remembering. One is alcoholic hepatitis, 2 is early cirrhosis, 3 is Mallory's hyaline. The last stage, we shall be going to cirrhosis. Before I go to the cirrhosis proper, I would like you people to kindly appreciate these two diagrams. This is a line diagram of the liver, and this is a cirrhotic liver, which you people can draw in your records. And what is cirrhosis? How do I describe it? This is a gross picture. Compared to the earlier enlargements, here the liver is a little shrunken. It can be less than 1 kg. It is quite firm in consistency. And when I see the external surface, it is not smooth. It is not very glistening. And there are fine nodules on it, which is called a classical hobnail pattern. So, and it involves the entire surface of the liver, not just the right lobe or the left lobe. The entire surface of the liver is involved. Capsule is thick and adherent. So here I find, again, it's a cut surface of the liver. I'm able to see multiple pale areas. Surrounding it, there is a relatively darker grayish brown areas. The pale area is the liver parenchyma, and the darker lines are the strands of fibrous tissue. So this is the gross and the microscopic gross and the cut surface of the liver. This I would like you people to kindly describe. A higher magnification of a similar picture, I find that there are multiple nodules on the surface. The nodules are of varying sizes. When they are going to be 3 millimeters, it is called as a macronodular. 1 millimeter, it is called as micronodular. Sometimes you find that can be a mixture of both, which can be called a mixed nodular cirrhosis, involving both the lobes, the entire surface, nodular. And this is called classically. This is a shoe that is worn by a soldier, and you find that there are nails fit on it. These nails will be broad on the top, and there is a pin over here. And this is called a hobnail pattern. This can be used for a boat pin, etc. This is called a classical hobnail pattern, which is found in cirrhosis. So when you describe a specimen, you should say that it is decreased, it is firm, there are multiple nodules, varying sizes, with a hobnail pattern. Let us go to the microscope. Here is a hepatic parenchyma, and I am finding the fibrous tissue getting interconnected from portal to portal, from portal to central vein. And there is a nodule of liver that is there. So this is a picture of cirrhosis. And in a full-blown case of cirrhosis, this is the picture that we see. Hepatic parenchyma, no central vein. This is again the hepatic nodule, separated by broad bands of fibrous tissue, which means cirrhosis. This is called the classical effacement of architecture. I would like you people to kindly compare this picture with this, and this is a beautiful architecture which is totally effaced in this case. So this will be the gross and the microscopic picture of cirrhosis of the liver, which can be asked as an essay, as a short note, a viva voce, or a multiple choice question. Many a multiple choice questions can be asked. And also it will continue in practicals and charts, a specimen, slide, and problem-based question. The references are R.A.T.S, Game, and Robbins. So this is the summary of the entire chart. You people are seeing a fatty liver. You are seeing the normal liver. There is early hepatitis, the malarious hyaline, the development of a cirrhosis, the gross and microscopy, hobnail pattern, classical full-blown cirrhosis, which can all be kept as a clinical history or a problem-based question. See you in next class.